Hi, I'm Nicholas Andrade with Nightingale College. This is my skills assessment video for oxygen therapy. I'm going to be applying a nasal cannula and a non-rebreather mask onto my patient. My supplies, of course, are the nasal cannula, the non-rebreather mask, my patient, my hand sanitizer, and gauze. As you can see, I'm wearing my Nightingale attire, my scrubs, and my name tag. So to begin the skills assessment video, I'm going to gather my supplies here. I'm going to knock on the patient's door, open, come on in, and close the door behind me for patient privacy. I'm going to introduce myself to the patient. Hi, my name is Nicholas. I'm going to be your nurse here. I'm going to be placing you on some oxygen here, see if we can improve your oxygen O2 stats. Can you tell me your name and your birthday, please? All right, may I please see your wristband? Okay, thank you. To begin, I'm going to sanitize my hands. All right, so patient, what we have here is a nasal cannula. Just gonna go ahead and open that up. As you can see, I placed it here in front of you on this sterile, clean, dry surface. And opening up the nasal cannula. So the way that this works is I'm gonna be connecting this to the oxygen. So these two tubes here are gonna go into each nostril, one for each nostril, and then I'm going to place the rest of the tubing behind your ears and down through the front of your chin there. Then I'm going to take this tube, connect it to your continuous airflow that is in your room here. It's indicated by that green oxygen meter there. And I'm going to make sure that this is connected. So to start, I'm going to place this onto your nostrils and around your ears. Do you have any questions for me before we begin? No questions? Okay. So to start here, I'm going to place the tubing down in front of you so I can get that stretched around you appropriately. I'm going to place the nasal upside down there. Place the nasal cannula into your nostrils, around your ears. It's going to come down to the front of your chin here. I want to make sure that is on there, nice and snug, but not too tight. We want to make sure that it remains in your nostrils, but that it's not too tight, but that it's not falling off. So if it is too tight, it can begin to create some skin issues there because of the rubbing. So we want to make sure there's no skin degeneration that begins to happen. So this tube right here is going to connect to the extension port, and that extension port is going to connect onto the oxygen source located on the wall there. So I'm going to plug that in there. Plug that in. So regularly, normally it's between 1 to 6 liters of continuous oxygen per hour. The doctor ordered you to be on 5 liters of oxygen. And so we'll go ahead and kick that up to the 5 liters of oxygen there. Make sure that the meter is reading appropriately. And we'll go ahead and see how that improves your oxygen there, okay? I'm gonna give you some time to go ahead and see how that helps you out there. Do you have any questions? No? Okay, I'll be back. I'll close the door for patient privacy. Give the patient ample time to see if his breathing improves, and assess him to determine if a non-rebreather mask is more appropriate. So I'm going to knock on the patient's door as I enter again. Open up here. Hey, it looks like your oxygen is still statting a little low, so the doctor wanted to place you on this non-rebreather mask. He ordered you at 15 liters of continuous oxygen per hour. So I'm going to go ahead and get my supplies here situated before I switch you out from that nasal cannula to this oxygen mask. The way that this one works here, I'm just going to set this on your chest here. This oxygen mask is going to fit over your nostril at this metal bar here. This green loop is going to go around behind your ears, very similar to that nasal cannula. And this bag here is going to stay right in front of you, and I've got that connected via this oxygen tube that's going to switch out the nasal cannula and replace that with this tube to make sure that we switch it over. Do you have any questions about that? No? Okay. I'm going to go ahead and take this off here, down across the front, remove that from your ears. Going to go ahead and place this on you, coming up over around that ear. Gonna make sure that this metal bar is situated at the bridge of your nose and that there's a nice seal there. Like I said, you want to make sure that it's tight, but not overly tight, because it needs to remain comfortable for you, and I don't want any skin issues to begin with my patient. So I want to make sure that he has a comfortable fit there. I'm going to take my tubing over here and I'm going to swap out the nasal cannula onto the green oxygen and make sure that the meter is set to the doctor's prescribed order of 15 liters per hour. So I've got that adjusted to the right setting there. This tube is connected. All right, do you have any questions for me? No? Okay, we'll go ahead and give you some time on that oxygen there to see how your stats are improving. See if we get that O2 to come on up there for you, okay? All right, I'll close the door behind me for patient privacy. And then I'm gonna come on in and check on my patient. Well, it looks like we got your O2 stats on up and it looks like you're breathing a little more normal now. You feeling any better? Yeah, okay. All right. I have here gauze, which we could have used if the patient was in discomfort, if the patient was on oxygen and he needed to be on oxygen regularly. His skin can begin to break down at various locations, such as around his ears where the mask is connecting, or potentially at the bridge of his nose. So to alleviate some of that skin tear and that skin breakdown, we could place the gauze under that strap and around his ears to make that a little bit more comfortable there for him. We can also have placed the gauze over the bridge of his nose, just fold it up a little bit so that it's nice and comfortable under the bridge of his nose, so that it sits on there a little bit more comfortable for him. But because his oxygen has improved and the patient is no longer statting in a concerning level, we'll go ahead and remove the mask here. All right. I'll go ahead and take both the nasal cannula and the mask and I'm gonna throw it into the waste bin here, gather up my supplies, throw it into the trash. I will go ahead and sanitize my hands. All right, so I'm glad that oxygen therapy improved your oxygen flow and you're statin normal there. Are you feeling comfortable? Okay. I'm gonna go ahead and return to my nurse's station. You have your call light here next to you. If you have any questions or concerns, you can always reach me. You just give me a buzz, I'll be at the nurse's station. All right, I'm gonna go ahead and open the door and then close it behind me for patient privacy. And that was my skills assessment video for oxygen therapy. Thank you.